I'm in our nation's capital, and it's made me think even more about the assault on reproductive health care. I became an OBGYN because of a negative experience I had with my mother's gynecologist when I was a teenager. I haven't necessarily talked about this, but when I was 17, I actually became pregnant by my boyfriend. I had been accepted to college, and I knew that I didn't want to be pregnant. So Roe v. Wade was the law of the land. My mother asked me what I wanted to do, and I said I wanted to have an abortion. I had an abortion in a hospital by my mother's OBGYN. I don't regret it. If the circumstances were the same, I would do the same thing again. And that I went to this doctor. His name is Dr. Martin. He's dead now, so I can actually mention his name. I went to him for a checkup afterwards, and he treated me with very little respect. He treated me like I was a slut, and he wanted to put an IUD in me. It was called the Dalcon Shield. It was later found to be dangerous. It caused people to have pelvic infections and actually have to have hysterectomies. At the time, I didn't know that, but I knew in my gut that that wasn't for me and that wasn't the right thing to do, so I refused. And he wrote me a prescription, kind of like threw the prescription across his desk for birth control pills. And I stayed on birth control pills until I decided I wanted to have my first child. That experience made me think that no woman should be treated like that. And I thought to myself, if I ever become a doctor, I'm going to be an OBGYN. At the time, I was planning to major in engineering, civil engineering in college. I actually did not want to be a doctor at the time. However, after the first 2 years of engineering, I figured out I didn't want to be a civil engineer. I didn't like, doing slope staking and doing all the things, the steel-toed boots, hard hat, things like that civil engineers did. So I decided to major in biomedical engineering, and I remembered saying to myself that if I ever decided to be a doctor, I would be an OBGYN. So I started taking pre-med classes, and fortunately some of my biomedical engineering classes were acceptable as pre-med requirements. And I ended up taking a year off between college and medical school. And then I applied to medical school and got into every school that I applied to. And I went to medical school. And I went to medical school with the intention of becoming an OBGYN. I had a mentor in medical school, Odell Owens, who was a reproductive endocrinologist. IVF was really just starting to be done a lot. That's in vitro fertilization to help people get pregnant, and I was fascinated initially by the science, and I really loved it. So my intention was once again to go do an OBGYN residency and at some point do a fellowship. I completed residency, and probably about 4 to 5 years after I completed residency, I actually did a fellowship in reproductive endocrinology and infertility and became board certified in both of those. And I've done IVF, advanced fertility treatments, for over 30 years now. I primarily give people advice. I've been seeing this sea change especially the overturn of Roe v. Wade, and have been holding my breath about how things that I have done, like in vitro fertilization, were going to be attacked. One of the things that people don't realize is that 1 in 8 couples are infertility, and infertility affects men as well as women, as well as trans people, as well as gay people. So this is not just a women's problem. It is a people problem. And the fact that the legislature in Alabama has decided that embryos are people is ridiculous. One of the things people don't understand is when a couple undergoes IVF, or a woman undergoes IVF, she makes multiple eggs. So for example, I'm just going to give you an example. Maybe 20 eggs are retrieved. Out of that 20 eggs, maybe 16 eggs fertilize. Out of the 16 eggs that fertilize, maybe 6 develop into an embryo on day 5 or day 6, and that's about a 100-cell embryo. If the embryos are tested genetically to see if they're abnormal, particularly if the woman is over 35, maybe only 2 out of those embryos, out of the 6 embryos that are tested, are actually normal. I tell patients every day that human reproduction is inefficient. So what happens to the other 4 embryos? Those other 4 embryos are not compatible with life, and they are not to be put back into the uterus. So those embryos get discarded. So the law in Alabama would say that discarding embryos is murder, which is completely ludicrous. Those embryos would not be able to develop into a baby. So you're going to tell people that they have to, or clinics, that, and the patients make the decisions about what to do with the embryos as well, that they're going to need to keep those embryos on, for indefinitely, and there's a fee for keeping those embryos. There's a storage fee. So you're going to keep embryos that have no chance of developing into a baby. So this is anti-family. All of these laws that are coming down are anti-family. They are anti-woman. They are anti-education. And the legislators that are making these decisions obviously have no understanding of what I do. And actually, I don't think they even care. So I'm feeling very cynical about this. I don't know what I'm going to do about it besides speaking out in this way and trying to educate the patients that I see. I've actually even begun telling patients in different states that they need to find out what their clinic is able to do according to the state that they're in. But it's like unconscionable what's happening in this country. It's really a sad day for reproductive health. And it's not just women's reproductive health. I mean, it's men's reproductive, or people that identify as men who produce sperm. It's their health too. So I just had to hop on and stay here. We have to advocate more. That's why I went into medicine, was to take care of people and advocate for their health and educate. Doctors are in a bind. We are not able to do often what's best for people because we're afraid we might go to jail for doing what's best. For example, sometimes a pregnancy implants in a fallopian tube, and if the fallopian tube bursts, that can be life-threatening. A woman can die from hemorrhage, and we often have to treat that with methotrexate, which is an anti-cancer medication which prevents the cells from growing. Is that considered abortion? So it's just really crazy for me to hear about all of these things that are happening that are they're anti-family. That's what they are. People have a very narrow view of what family is. And these are anti-women, they're anti-family, they're anti-trans. They're just, it just is really frustrating. And as a doctor, to not be able to do your job and to not counsel someone appropriately about what is best for their health is against the Hippocratic Oath. It's not proper ethics. It's not ethical. It's wrong. It's totally wrong. So I don't know what else I'm going to do about it besides initially speaking out about it. Being here in Washington, D.C., I've walked by the monuments. I went to the National Gallery of Art. I went to the National African American History Museum. And I walked by a statue of a woman, and it said, "History is prologue." Well, the history that's happening is like a backlash to all of the phenomenal changes that have happened in women's health or people's health across the past 100 years, including the advances in being able to control our reproduction with birth control, but also, IVF has been around probably over 50 years now and has gotten better and better, but still, it's not accessible to many, many people depending on what state you live in. And then this whole idea of regulating IVF and the byproducts of IVF makes no sense. And part of that also has to do with we don't educate people about sex and reproduction. So I'm not sure what else to say about this. I do have another Instagram page, but this is my main page, and I just had to talk about this because being in a place like Washington, which is the seat of power in our country, and I was at lunch talking to my girlfriends that I've known since college, and one of them I went to medical school with about this as well, and we're just like, what is going on? So I don't know how much this will make a difference. I don't know if it'll make a difference. Sometimes I feel very, very cynical about all this, and often I just want to go lay on a beach and not say anything. But this is so against why I went into medicine, why I became a reproductive endocrinology and infertility specialist, why I became an OBGYN, and I just had to say something about it. I don't know. Like I said, I don't know what I'm going to do. I don't know if this is a young person's fight. I don't know. I don't know. But I just had to say something. Thank you for listening.